Hello, hello. Oh, that's loud there. Hello, everybody. Good morning. My name is Victoria Cabrera. Welcome to the Medicare Space live show. I have my lovely guest over here.
Sylvia Toscano.
Oh, you're not even talking in the mic, Sylvia. You forget.
Sylvia Toscano. Good morning, San Antonio.
I am so mean to her in the morning
She
because
is, and I bring her coffee every morning. That's why she's all wired up.
I know. I'm like,
No more coffee for you.
She put like 5 shots in here. I normally drink a grande, and she gives me a freaking venti with.
Too bad.
I can't even breathe right now.
It's hot. I'm having a hot flash. So is she.
Anyways, guys, welcome to the morning show with us. Yes. 5, 4, 3, 2, 1. And
Action.
welcome.
Welcome to Freaky Friday with Victoria and Sylvia.
We are freaky sometimes. So tell me about your week, Sylvia.
What did I do? Nothing. Rained. I finally planted my vegetable garden on Monday, which was great because then it rained all week long. So I'm hoping I'm going to get an abundance of herbs. And I did plant carrots and tomatoes. My tomatoes were horrible last year. They died. But I'm going to
Is it thing? Let me fix it for you. Let me help you out here. Come here. Bring it on over. We're going to tighten this thing up for you. All right. There you go.
Okay. So hopefully I'll have vegetables and fruit.
What are you growing?
Strawberries and all kinds of carrots and eggplant and zucchini and tomatoes and herbs, dill. I love dill.
Wow, nice.
And kale. So kale was the only thing that survived the snow of 2021. And it's huge. It's about this big. I have tons of kale.
So when we're in the apocalypse, we need to be growing kale.
Yes. Okay. So I'm practicing just in case it's around the corner. I already have my seeds and everything. So how was your week?
The only thing that survived in the apocalypse for me, the snowstorm, was the beer. I mean, not really, but
no, it didn't survive for me. That was gone immediately. That was gone.
Well, that's good. So you have a green thumb. You are growing a garden. Well, we're sorry we missed last week's show. I was out of town at an awesome event. For work, I try to do these events often and just to keep my brain right and keep me on track to continue to help people. And so last week I was at the SWAT event in Dallas, Texas. And so sorry guys, that's why we missed the show last week. And sometimes that will happen because I'm not always going to be in town every Friday, but we promise when we do come back, we're going to bring you on the best shows, the most information, and everything you need to know about Medicare and resources that are available to you out there. So, Sylvia, what are we going to talk about today?
I was thinking, let's talk about HMOs and PPOs.
HMOs and PPOs.
I get a lot of questions on people. Everybody's so afraid of picking up an HMO. They're like, no. I think HMOs had a really bad rap back in the 60s. And so now people that are turning 65, they're thinking, I remember the HMOs back then. I don't want it.
Yeah.
So let's talk about that, the big difference between them.
And as always, if you're watching the show, be sure to go ahead and put your name in the comments. We're going to be doing a raffle later on today. You don't have to be present. We already gave last weekend. We gave, what did we give away?
The week before last, we gave gift certificates.
Gift certificates to Chick-fil-A, Whataburger, Starbucks, and Dunkin' Donuts. And what else? And then the week before, we gave a toothbrush, an electric toothbrush.
Just one toothbrush and the little barbecue pit thing.
Okay. So be sure if you're listening and put your name in the comments, tag somebody. We're going to be giving away, what are we going to be giving away today? Oh, those folding chair for camping because summer's coming up. You're probably going to be going to the grandkids' baseball games or your kids' baseball games or football games, whatever you might, or maybe you're going to concerts now. Hopefully we open up.
Thank God everything's opening up. Does anybody know if the retirement park is open tomorrow?
Oh, it is?
I don't know.
Oh.
I've been calling them for the last 2-3 days. They don't answer. And I've looked on the website because tomorrow's the Kentucky Derby. I get to wear one of my big old hungry hats.
You should have worn today.
I know, I should have. But I didn't. So if anybody knows if it's going to be open tomorrow,
put it in the comments. Let us know. Sylvia is dying to know.
because I want to place a couple of bets.
She's a better.
I'm a better.
Me too. That's why we make wonderful friends. But
Yes.
except when we're in Vegas together, and then we're walking out crying out of
except one time that I won. But anyway, that's another story.
So again, if you're watching the show, share the link so that way people can see that we're live right now. Also, put your name in the comments if you're watching, so that way we can enter you in the drawing. Again, as always, it doesn't matter what your age, doesn't matter where you're at, doesn't matter if we know you. Another thing that we're giving away is going to be a cool little lunch cooler.
Yes.
So if you're a senior, you could put traveling, you could put your lunch or your medicines, or if you're just somebody else watching and you're not a senior, those pack about 3 or 4 beers in them, right?
Yes.
So you do a little personal
or little mini wines.
Oh yeah, that's a good one too. Yeah. So again, if you're watching, doesn't matter if we know you, put your name in the comments, share the show, so that way we can enter your name in the drawing. We do it every show at the end of the shows. And then today, again, we're giving away a camping folding chair and lunch cooler. And we've gotten smart, okay, because we have listeners all over.
I know.
Okay. So what me and Sylvia are doing is, instead of buying it here and trying to mail it off to you, we're going to actually just send it through good old Amazon.
You love Amazon.
Right to the privacy of your own home. Okay.
Yep.
And if you don't want us knowing where you live, then screw you. No, just kidding.
Well, I think they can send it to
yeah.
the little boxes.
Oh yes, those little stations that they have.
Exxon and stuff like that.
Otherwise, I'm gonna be like at your home.
Knocking. We will be lurking. Or we'll just keep your gift.
Oh yeah, we'll just keep your gift and re-give it away. So anyway, we want to get into the show, but if you're watching, please put your name in the comments. Doesn't matter if you're family, friends, foe. It doesn't matter who you are.
Friends.
Put your name in the comments, so that way we can. It doesn't even matter if you won. Again,
yes,
because you're a listener, you get awarded for being here. Okay, we want to thank you for your support. So today we're going to be talking about HMOs
and
PPOs, specifically towards Medicare Advantage plans in the Medicare world. But doesn't matter, because if some of the same rules apply, even if you're on a group insurance plan,
retirement, any insurance, it's pretty much universal when it comes to the HMO and PPOs.
Exactly. So basically, anything that you want to know, we're going to do it here. So let's start off. I want to start off with an HMO. Okay. An HMO is a health maintenance organization. Okay. It's a fancy health maintenance organization. So if you're writing notes, write that down. And what it basically means is, well, let me explain. HMO and PPO are network-based plans. So Sylvia, what's a network?
Network is the doctor has to be in network. Now, I don't want to go too far off. Some of the PPOs and even the HMOs have out of network, but they will be at a higher copay. But network means that whatever plan you choose, whether it's an HMO or the PPO, you have to make sure that your doctor is in network. And so it's very important that when you're speaking to your agent, you have your whole list of doctors, because just because they accept your primary doesn't mean they're going to accept your specialist. And even if they are in network, if your doctor's in a specific medical group, it doesn't mean that group is going to accept that specialist either.
So in a nutshell, a network is basically this. Think of Sylvia's trying to confuse her. So
you've got to keep up with me, okay?
Again, she's had some coffee, okay? So a network is, just think of the doctors, the specialists, the hospitals, the laboratory.
That's what you wanted.
Yeah. Okay. The just, simple version. We're talking to people that might
practice on any of this.
Well, yeah. So
that's why.
Yeah. So just think of a big circle with doctors, specialists, hospitals,
all in there.
And they're all in this circle. And that's your network, right? And we're going to talk about now, we're an HMO, and health maintenance organization. When you look at an HMO, you hear this thing that says in network only. Okay. So when you think of that circle of the doctors, the specialists, the hospitals, the facilities that you want to use, and you're on an HMO, specifically a Medicare Advantage plan, again, it applies to group insurance as well. But if you're in an HMO, you have to stay in a network.
Yep. You have to. And what happens?
What happens if you go? Raise your hand.
Raise your hand.
What happens if, Sylvia? What happens if I'm on an HMO? Okay,
because you're old and 65.
Well, no, just that. Yeah. 65 is not old, by the way.
65 because I'm like right there. I'm knocking.
So if you're on an HMO, okay, if you're on an HMO and you go out of network, so pretend I'm your customer. Okay. And you put me on an HMO plan and you told me that all my doctors were in network, but then my friend next door recommended this cute doctor down the street because she says, you have to go to him because he's so handsome. Right. And I walk in his office.
That's why I go to doctors.
and I give him my card. And then they say, well, you're not, we don't take this plan, but I still want to see him. What happens?
You're going to have to pay out of pocket. And that's a bad thing because sometimes they don't tell them, they'll just accept it because the people in the office might not be familiar with the insurance. And then they'll get a bill of $200-$300. So if you go out of network, you're going to have to pay the full amount of the bill.
Okay.
Because the insurance is not going to pay for it. And
now let's talk about that really quick. So when people go into specifically Medicare, okay, we're talking about Medicare.
Okay.
When somebody decides that they want to go into a Medicare Advantage plan, okay, and they say, well, I just got my Medicare card. I want to go into a Medicare Advantage plan and I want to go with an HMO plan.
Right.
And some agents out there don't tell them, right, that the Medicare Advantage plan almost acts as a replacement to original Medicare.
Right.
They don't lose Medicare, right? But it acts as a replacement. So what happens is when they go to the doctor, what do?
They give them the card.
Which card?
They should give them the Medicare Advantage card. So you pay Medicare, and Medicare turns around and pays whatever plan you choose, whether it's Humana, Aetna, Blue Cross, whatever. So Medicare is your foundation, and there's your new insurance card. So every time you go to the doctor, you're going to give them that Medicare Advantage card, whether it's your doctor, your specialist, HEB for your pharmacist, you're going to use that card.
That all-in-one card. But what happens in some cases where agents don't explain that to their clients? What normally happens? They'll try to give them the original Medicare card, right? So if I'm a client and I go to the doctor and I give you the red, white, and blue card instead of the XYZ company card, right? If I give them the original Medicare card and I had XYZ HMO, what's going to happen?
Usually they'll look it up and realize that they have a Medicare Advantage and that they're not in network and they're going to turn them away.
Yep. So it's important when you're in an HMO to really understand the characteristics of an HMO. And I know I'm getting a little bit analytical here, but it's important because with an HMO, there's some characteristics, right? You have to stay in network.
Now, does that apply to everything?
No.
Okay.
But let's go over these three factors and then we're going to go over when it's okay. So the three ones, we have to stay in network. Okay. So that means you have to stay within the network. That's
number one.
I love it.
I was waiting. I knew you were going to respond with number one.
She loves that finger. Okay. We're going to be the number one live show every Friday. Okay. So we got number one, we got to stay in network. Okay. Number two, what's the next characteristic of an HMO? Can y'all guess it out there? Say it out loud if you know. What's the next characteristic? Referrals. To me, that's the most important because specialists are more important to me than the primary doctors. Ooh. Not that they're not. Don't wait a minute. We have a couple of doctors listening.
I'm sorry. No. You're just as important. But if you have a cardiologist or neurologist that saved your life for some reason, you're going to be more likely to stay with him and change primary doctors. I don't know why I went that way, but I did. I tell you, too much coffee. But yes, you need referrals, and they're important because if you want to stay with a specific specialist, you need to make sure when you speak to your agent that they are all in the network.
Yeah.
Now, what happens if my specialist takes my specific plan that I'm enrolling, but then I go to him and they say, no, because your primary doesn't accept him.
They don't refer out to that particular specialist, and that happens a lot. So that's why when we're talking more Medicare Advantage, we'll get into more of the umbrellas of the networks, like the network within a network. So referrals is the second one. So we have network, in-network. We have the referrals. And then normally HMOs, the characteristics of an HMO is there might be these pre-authorizations that have to happen prior to getting like the surgeries and things like that. I mean, there's always going to be that regardless, but so it's important when you have a upcoming surgery. So let's pretend you're a client. Well, let's just say you're not our client yet. And you come to me in Victoria. I switched over to this plan and I don't like it. I used to have this other company and I don't know why I changed. Can I change my plan? Well, if we figure out that you have a qualification to move right now, we always ask you, do you have any upcoming procedures coming up? Why do you think we're going to ask you that?
Because if you move from one insurance to the other one, all those referrals that were in place before are void. So now you have to start basically all over again. If you're staying with the same doctor, it's okay. So they'll just submit. But the new insurance or whatever insurance you're moving, they're going to want a referral, or the doctors are going to want a referral, whether it's your specialist, MRIs, CAT scans, colonoscopy, everything. They're going to want a referral. Yes.
Nobody wants a colonoscopy. No. Good thing they put you to sleep.
That was a good one. Good thing they put you to sleep.
Yeah, and you don't want that twice, by the way.
You don't want to want.
Oh, so we always ask, because when you're on an HMO, there's a little bit more rules, right?
Yes, rules and regulations.
Now we don't want to like tell you all the negatives, right? Because in some cases that might not be a negative for some people.
But that's good. So like today's the last day of the month. So if you sign somebody, I'm meeting with somebody today. So I have to make sure that they don't have anything else in place because they're not going to be able to see their specialist, or if they have any procedures coming up. So make sure you speak to your agents when you're meeting with them, and make sure sometimes they're not going to ask you. Sometimes they want to go in there and sign you, vámonos.
Yeah.
So you need to be proactive with your coverage.
So we're telling you right now, if you're seeking out new insurance and you don't call us and you have an agent that you're working with in another area, one thing you want to make sure is, number one, if you're on an HMO, make sure they verify not only your primary care doctor, but your specialist that you're seeing as well. The second thing you want to do,
and the hospital.
Yeah, and your preferred hospital. Yeah. That's right. Yeah.
So I've had people that want to stay with a certain hospital. That's just the way they are. So everything, go down the line, make sure everything, the pharmacy that you want to go to down the street,
Yeah, we're going to have to put a top 5 question, where there's actually a lot more that you should be asking, but just the top 5, maybe post it somewhere on our channel or our Facebook. So that way you guys know what questions to ask when you're changing. So we went over the network. So you have to stay in network. You have to get a referral to see a specialist, or for anything for that matter, right? And then you want to be careful when you have upcoming procedures, because a lot of those have already been authorized for you to get those done at a specific location or with a specific doctor. And when you make changes, we always want to prevent those changes from interrupting your upcoming procedures that you have going on. And then let's talk about some of the benefits though of an HMO. Okay. The benefits, not specifically like the dollar amounts, but the benefits. So in an HMO, the great thing is your care is almost this coordinated care. Everybody, all the providers are working with you to make sure that you're getting the care that you need, right? So think of your primary care as almost like your gatekeeper. They're like,
that's why they call them the gatekeeper.
And so they're going to be the ones to say, okay, Sylvia, you did your blood work every 3 months. Everything looks good. Okay, and we got to get this done. We got to get your wellness visit done. We haven't done your colonoscopy yet. So they're going to look at all
noise again.
And God, we skipped the Friday, so that's why we're a little bit more silly this day. And then I forgot what I was saying. See, I forgot what I was.
The gatekeeper.
Okay, the gatekeeper. So the gatekeeper basically keeps your care coordinated with all the different providers within the network. Okay, so that's a good thing because one, especially for men and women
and
too,
for women are kind of chicken.
Because I'm like that too. Is where, God, I don't want to be in the doctor, or I don't want to do this, or I don't want to get my lab work. I'm afraid something's going to come up in the thing. Well, that's what preventive care is covered. Okay. So HMOs are good in that sense, is that they have a little bit more coordination of care. Okay. Another thing is that HMOs tend to be very, very rich in benefits. So what that means is that you might see your copays for specialists, for hospitals, for CT scans, MRIs, they might be a lot lower than they would be in a different type of plan. And another thing, specifically on Medicare Advantage plans, not your group insurance coverage, but specifically on Medicare Advantage plans, you might have those additional benefits that original Medicare does not cover, which I think they should just make those mandatory already.
Yeah.
Dental and vision at the very least, right? Because dental, it's already proven.
It's very important.
Yeah, like your dental health is just important.
And the vision, I don't understand, because as I forgot my glasses. I forget something every time I leave my house. My reading glass, I can see the money.
Can you see how much money's here?
I can see. And I thought it was real. I was like trying to.
Well, it is real, Sylvia. Nobody knows that it's not real.
But like glasses, once we get my age, I need to go get some glasses and have my eyes checked. And the Medicare doesn't cover that. So the Medicare Advantages, they cover the exams and the glasses. And so, which is good. You're right. Medicare should implement that on just for themselves.
On the preventive side of things, like your everyday, well, I would say every day you always use your eyes. So it's not a,
but you do.
Yeah.
They need to do that.
So those are benefits of an HMO, even though there are some disadvantages, right? There's always a give and a take, right? Or pro and con. You're always going to have benefits or disadvantages. So those are the characteristics of an HMO. If you missed that, you can go back and rewatch this as many times as you want. It's on our YouTube channel. It's on our Facebook pages. Go back and do that. Now, the second one, and again, if you're listening in, please put your name in the comments, because we'll put you in a drawing. We're not going to call you. Trust me. This is not to just get your information and spam you.
No, we're not.
This is literally like writing your name down on a piece of paper, and we're going to go ahead and put you in a little container somewhere that I don't think we have. And we're going to draw your name later. You don't have to be present. Just make a comment down below. It helps us reach more people, and more people were able to watch live. So go ahead and put your name in the comments if you are on the stream right now. So
and if they want to call me,
and if they want to call Sylvia, you
210-878-9534, because she never remembers my number.
Yeah, I do. 210-878-9534.
There you go.
I've already memorized it now.
Okay.
So like I said, if you're listening in, put your name in the comments, or just put, hey, what's up? And then we'll enter you in the drawing, or tag somebody so they can listen in today. So the next one we want to talk about is going to be a PPO.
Yes.
A PPO is a preferred provider organization. Okay. The same thing. Y'all learned what a network is. Okay. It's that, remember, it's a circle of
love.
It's a circle of love with your primary care doctors, specialists, your ambulatory services, your hospitals. That's a network of providers, a network of, we call it, in the insurance word, we call that a network. Okay. And so with the PPO plan, here's the characteristics of a PPO. You have in network and out of network. So if you fall out of the circle of love, you're still going to get a little bit of love there. Okay.
Yes, not a lot, but a little bit.
A little bit.
Little kissy.
So you're going to get the in-network, okay, which is the big circle.
Well, and the copays are going to be what the plan
has. The costs are essentially lower if you stay in network, or you can go out of network and you won't be penalized as much. So you can still see doctors that are out of network, but you are going to have to pay a little bit more money to do that.
And how much?
Well, it honestly, we can't say that because it depends. Every service area, specifically,
Exactly.
and honestly, any type of PPO plan.
And some of them have deductibles if you go out of network.
Some of them have deductibles, higher co-pays, higher co-insurance. And so if you don't know what deductible, co-insurance, and co-pays are, we can definitely help you understand those. Those are easy terms. But so on a PPO plan, you have in-network and you have out-of-network. Okay. If you stay in the network of providers, they'd get what? Lower cost.
Yes.
If they go out of network, you pay what? Higher cost, right?
So, and it's important that you check.
Yep.
If you're picking up a PPO, you check how much, just in case, because you never know.
Yep.
You know, like your friend down the street that wants to send you to a pretty doctor.
Yes.
How much are you going to pay more for that pretty doctor?
Exactly. Good morning, Josie. Sorry she's late. So again, guys, if you're listening, put your name in the comment. So far, we only have Josie that's going to win the lunch cooler and the camping folding chair. So if you're
day, what's up with y'all?
I know everybody's sleepy. It's because it's raining and nobody's awake right now.
I know my dogs have slept for like 3 days.
So
comfortable.
Oh, I want to go lay. I want to go lay with my dog too. See, but we get up early, so that way we can bring this information to you guys.
For you.
So then another thing of a PPO is basically on a PPO. So don't forget, guys, put your name in the comments so we can raffle you in. So far, we have Josie. She's the only one. She's going to win too. So if you want to get in, do it now. And so on a PPO, basically, we went over in-network. There's Jessica. Good morning, Jessica.
Good morning, Jessica.
So in network and out of network, what's another good characteristic of a PPO?
Well, they don't need referrals.
You don't need referrals to see a specialist.
Right.
Okay.
So you can go straight. So on the HMOs, remember, you have to see a primary doctor. And if you want to see your specialist, you need to give you a referral. So with PPOs, you can go straight to your specialist. You don't need to go see your primary doctor, which is good.
Hello, Claudia. Good morning. She's been entered. So we got Josie, Jessica, Claudia, all entered in for a drawing. Sorry, I didn't. I always interrupt Sylvia. I'm sorry.
Bad habit.
It's a bad habit. And then that's why she always hits me. We got
I was just gonna do that.
We got Emily. Emily's entered in. There we go. We got another one. So going back to a PPO.
Okay.
I know. I'm so ADD. PPO. We were already going to go put mimosas in our
people. Forget it.
So on a PPO, basically, you don't need referrals. So if I have a PPO, Sylvia, and I want to go see a doctor, and I called my agent, and they say, "Oh yeah, he's in your network. He's good to go. You can go see that doctor."
Right?
Do I need to go to my primary care doctor to see the specialist? No, that's the beauty. That's the flexibility of a PPO. So again, you're always going to get something, and something's going to be at a price, right?
Right. And what is that price?
The price is in the copay. Boom, boom, boom. I think we're using too many sound effects today.
So we have to get different sound effects.
Yeah. So basically, if you go to a doctor and you want to get that, if you don't want to get referrals and you're like, gosh, I have to get referrals every single time I go to the doctor, then yeah, you basically might want to go ahead and go with the PPO if that's the situation. Now, another characteristic of a PPO, so they have the in and out of network benefits. They have the option to go out of network. Oh, I'm sorry.
Good.
At the copay, but the copays
are a little bit higher.
They tend to be higher, right? The cost or even co-insurance tends to be a little bit higher
because you have that freedom, and with freedom, unfortunately, comes a little bit of extra cash.
So you're like the genie in the bottle, right?
Yeah. if you want freedom to see whomever doctor that's still in the network, but without referrals, you're going to have to pay a little bit more. And that's the cost. So that's what I tell people. Do you want to wait maybe a couple of days for a referral, or do you want to pay a little bit more? To me, it always comes down to money.
Yep.
And the convenience, what's more important, saving a couple of bucks or waiting, a week or so for the referral.
So, and let me tell you, everybody's different because in my brain, right, the way I think is I'm all about convenience. Okay.
Yeah.
I'm like, I'll spend to save time, right?
Yeah.
So if I see something I want, I don't even look at the cost. I mean, I do, but I don't, and I buy it. Whereas Carmenza, my little wifey, she takes her time
And
she finds savings, and then guess what happens? She loses out on deals because she waits too long. If you're watching, baby, you know what I'm talking about. Okay,
and I'm like that the way you are, but when it comes to my clients, I'm a little tight, and I'm not. I'm like,
yeah,
I have.
Yeah.
Money is no issue to me.
Well,
and so, but when it comes to my client, I always look at their income and what they have to pay. Because a lot of times the first thing they tell me is, oh, no, I don't want an HMO. I want a PPO. And then when we look at the co-pays, then they're like, well, maybe not.
Well,
yeah, you know, so everyone's different. I've gone to client's house with the husband will pick an HMO and the wife is like, oh no, I want to save my money.
Yeah.
I'm going to Vegas.
Okay.
I want.
Can I go with that person? I'm right there.
That's exactly what I tell them. They want an HMO. So it's an individual. It's what every individual wants.
Yeah.
Yeah. Just because they're married doesn't mean they both have to pick up an HMO or a PPO.
And there are other types of plans out there. We don't want to get into the weeds with that because there's POS and there's other types of HMO POS. And we don't go over those right now because the most popular ones right now are HMO and PPO plans. And we really wanted you to understand the main characteristics of each, because a lot of people, unfortunately, guys, there's agents or even not even agents. Okay. What happens is somebody turns 65 or they're on Medicare, and they want to talk to their buddies at the senior center, or they want to talk to their neighbor, and that neighbor says, oh, you need to get on this plan, and this is what I have, and this is what you should get. But guess what? What they have is a whole different fit than what you need. And so when you're just following the leader over there, and they're not, they're not professionals in the field or experts in Medicare, then you end up making decisions that can possibly hurt you. And let me tell you, when you turn 65, that might be one of the most important times in your life, right? Because there's these situations where when you're looking at Medicare supplement versus Medicare Advantage, there's only certain windows that you can get into certain plans. And we kind of talked about that on previous shows, so I won't get into that right now. But let me, so basically, just take that seriously, right?
Right.
And get with somebody that's been doing it for a while.
Yeah.
I'm going to put your number here, Sylvia. Call Sylvia if you have questions. Okay. Now, if you guys have questions, put them in the comments. Okay. We have Sylvia's number there. So if you guys have questions, specifically if you're a client and you want to call Sylvia, or if you just want to have, I won't do that to you. If you're a client, call Sylvia. She could help you. Okay.
I was going to ask you a question.
So if you were just entering, we were talking about the difference between HMO and PPO and how they are different, just because a lot of our clients that are on Medicare, when they go with the Medicare Advantage plan, they don't look at all the characteristics of each plan. And sometimes they end up choosing a plan that's not a good fit for them. Now, the great news, like we've talked about in previous shows, every year you have this Medicare annual enrollment period where you can change your plan if you want to go from an HMO to a PPO. And sometimes you can even have a special election. We have quite a bit of those in Texas where we can help you change your plan now. But the first thing is looking at all your situation. But when you're looking at, even if you're on group insurance, if you're listening and you're on a group insurance plan, it's the same characteristics, HMO and PPO. The only difference is with group insurance, you're probably looking at a deductible versus just straight copays right away. Or even if you're on an ACA plan, well, there really are no PPOs in our area, like qualified health plan PPOs in our area for the ACA. EPOs. There's another one, EPO and HMO, but we won't get into that because we're talking about specifically Medicare Advantage. So if you still have questions on that, let us know, and we want to answer those questions for you. So again, if you're listening in, go ahead, and we have quite a bit of, so we have Josie, Jessica, Claudia, Emily so far that have entered in the drawing. So we're going to be doing that at the end of the show, and you do not have to be present to be here, although we would love for you to stay on and continue watching with us. So another thing, go ahead.
So these HMOs and PPOs, are they everywhere in Texas?
Ooh, that's a good one.
Good question.
No, it is specific to your service area. Well, it depends because
your county.
County service area, county. Yeah. And let's see who else we got in here. Okay. So basically what Sylvia was asking when it comes to Medicare Advantage plan, are HMOs and PPOs available in every county in Texas? And the answer is no. Because when on Medicare Advantage, they look at the service area, which service area is just the amount of counties specific to that particular plan. So like here we have Bexar County, Atascosa, Wilson, Guadalupe, and Corpus. It might be San Patricio, Nueces. So it just depends on where you're at. Okay. But what we do is when we get your zip code and we plug it into our system, and you provide us the county that you're physically in, we could pull all the plans that are available in your area. So let me ask you, what happens if there's no HMOs in that area?
Then PPO. Then unless you're just turning 65 and you're able to pick up a supplement, then the PPO are the best in the area because they cover you more than the regular Medicare.
Yeah.
And they have the drug plan in them built in. So they bundle the drug plan in it and you don't have to pay anything extra for the drug plan. So a lot of counties only have PPOs.
Yeah.
Great PPOs out there.
So I run into that situation a lot where I get clients that call and they're all excited because they have, and like I'm in Texas, right? We're in San Antonio and you have Comal County and Guadalupe. And you literally can go from one block over to this other side of the highway and you're in a whole different county. Well, there might be totally different plans. So again, if your sister's calling, hey, Rita, I always use Rita. I'm going to meet a Rita one day.
But hey, Rita, I don't like that name.
Well, there's a Rita listening. So
I love that Rita. On the other one.
I'm just joking. So let's just say, hey, Rita, you should go with XYZ company. Yeah. And they're over here on the other side of the highway, different county. And they're like, yes, I'm going to get all these benefits. And then you meet with your agent and we're plugging in the plans. And guess what?
Nope.
Wah, wah. Yeah. Nothing comes up, right?
I had a block. One sister lived in front of her, and then there was the line. What do you call it?
The county line?
The county line. And so she was on the other side. And she had was PPOs.
Wow.
It's crazy. One block. She could not understand. I had to draw her. I like to draw pictures and explain. So I had to draw her why this was this and that. It was crazy.
You know? I mean, it's just so different when you're plugging in that information and the world of a difference it can make on the plans that are available. And we hate to be the bearer of bad news.
And sometimes we are.
A lot of times we are.
With the insurance and doctors because a lot of times people think, oh, the doctors accept it.
If you have a question and you want to call us, let me know. We'll give you the number. We'll plug you into this live. So if you have a question, raise your hand in the comments and you can call me. I'll give you the number and we can plug you in live. So you can be on our live Medicare live show.
Podcast.
We'll get you live on here. So if you have a question, raise your hand and we'll bring you on. We'll call you and get your question answered. And again, if you're new to listening and you haven't put your name in the comments and we're going to enter you into a drawing. We're giving away those camping folding chairs for whatever you want to use it for. And a lunch cooler, a little lunch cooler. So that way, if you travel a lot, maybe you're an agent and you like to put your food, maybe you're a customer, you want to put your medications, or maybe you just need a new lunch bag. We're going to go and get that to you. And we're going to send it through Amazon.
Yeah, it'll be easier.
It's Prime, Amazon. So you get it within the next 1 or 2 days.
Oh yeah, you get it like that.
If you are listening and you won last week,
okay.
I just mailed your stuff in on Monday. I was out of town last week. I'm sorry about that. I just mailed your stuff Monday. So you should be already getting it today, hopefully. So again, guys, what we're trying to do is we're trying to bring the information so that way you can understand how these things work. If there's a topic you want to listen to, or if you want somebody, if you're a vendor or you're a community partner and you feel like you have value you want to add to our audience, let us know. We might be the experts in Medicare, but we're not the experts in everything. I mean, we'll be honest. I mean, we try to be.
But we're not.
We're know-it-alls, but we're not experts. Fake it till you make it, right?
Yeah.
But we know a lot of people. I know Emily Trevino was like saying that how she knew all these people. And she did a video saying, oh, yeah, I know if you tell me about, let's just say this person, a chemistry professor, whatever, she'll know somebody that knows somebody. So it's crazy.
7 degrees of separation.
7 degrees of separation. There you go. So if you're a vendor, a community partner, a provider, a doctor, somebody that brings value to seniors, or maybe you provide resources that the community should know about, let us know. And we want to put you on the show. You don't have to be here physically. We can get you on a phone call, or we can put you on the screen and as kind of like a Zoom call, and we'll bring you on. Or maybe you're a client of ours and you want to tell how bad we did, how bad of a job we did.
She did.
Come on down, and we want to hear from you. So one thing I did want to point out when we were talking about networks, because I didn't want to confuse you guys at the time. Okay. In certain areas depends on where you're at. Honestly, this is anywhere. If you have an HMO plan, specifically Medicare Advantage plans, and we're going to try to do this without naming any names, okay? If you're with the medical group, and let's just say you have a primary care doctor and you're assigned to a specific medical group.
Right.
Some health plans, how they work is this: once you're assigned to that primary care doctor in that medical group, they have almost like this, I call it a network within the network.
Right.
Okay.
A circle within the circle.
A circle within the circle.
Yes.
So a lot of times when you are assigned to these medical groups that have a large network of their own primary care doctors and their own specialists, what tends to end up happening is, let's just say, as an example, I'm assigned a Dr. So-and-so down the street with
Toscano.
Dr. Toscano with so-and-so medical group. Okay.
Toscano Clinics.
Toscano Clinics. Putting it out there in existence. She's going to be a doctor one day, folks. Be careful. Okay. And then, so I'm assigned to Dr. Toscano.
And you come and see me.
And I come and see you.
And you won.
And I'm like, oh, Dr. Toscano, I love my cardiologist. I've been seeing him for 20 years and I don't want to go with anybody else. And he's in network with my plan. And can I get a referral to see
Nope.
What?
Nope. Because I have all these other great doctors, cardiologists that I work with. And so, Victoria, I want to send you to my cardiologist. I know you've had him for 20 years, but I want to send you to my cardiologist, Dr. Garza over here. And so,
but why, Dr. Toscano?
Because these are the doctors that I work. They're in my little circle. So what you should have done, Victoria, is when you signed up with this insurance, you should have make sure that your agent, make sure that the cardiologist you wanted was in the network.
Of the network.
Of the network.
But nobody told me how the network in the network worked out.
Well, then you should have listened to Sylvia and Victoria podcast on April the 29th, or what are we? And you would have found out. And that happens a lot.
Yeah.
And the worst part is that a lot of clients will call the clinic and they'll ask, do you take blank insurance?
Yep.
And the people in the front office say yes.
Yeah.
And then you meet with them and they're so adamant about, well, I called them and they said yes. And they said yes. It's like, well, a lot of the plans have 4, 5, 6 different plans in them. And so they might accept one, they might accept the PPO, but not the HMO, even though they're in the network, but their doctor, like you said, their primary doctor does not refer out to them.
Now because for us agents, and there's even some agents out there that still don't know. So I'm not going to say all the agents know.
Right.
But most agents kind of know how the medical groups in their specific area work. And they'll tell you, hey, just to let you know, if we assign you with this doctor over here, what's going to end up happening is they're going to want to refer to all of their specialists that are within their network. So the cardiologist that you've been seeing, or the endocrinologist, or anything with ologist that ends with ologist, right? Basically, if you're seeing those, and even though they're in the network of the plan, you still have to get that referral. And that's why we call it a gatekeeper with the primary care doctor. And that primary care doctor may very well say, no, we have to keep it within our network of providers.
And this is to the agents that are out there. I know a lot of agents, I mean, it's good. every agent should, once they get on the website of whatever plan you're selling, it'll tell you, yes, the doctor's in the network. But if you scroll all the way down, it'll tell you what medical groups they work with. So if that doctor is not within that medical group, they're not going to accept it.
Yeah.
So, and a lot of them they'll just say, oh yeah, he'll accept it. And then they'll come back and say, well, they don't want to refer me.
And it sounds so confusing. That's why I like Medicare supplements so much. But a lot of our clients tend to go with Medicare Advantage just because of the income situation, maybe a very fixed income or lower income. So sometimes supplements not the best option for them particularly. But that's why I like those supplements, because you don't have to worry about any of this. Right. You pretty much go wherever original Medicare is accepted. So that would be an ideal situation. But like we said before in past shows, there's always pros and cons of every situation. So there's no wrong decision. Right. Just understand when you choose a plan and you're in a type of HMO plan, it's going to take a little bit more work in the beginning to get everything situated. But once you have everything situated, you're good to go. Okay. Right. And so, but you always want to have relationships or stay listening into the show, or call Sylvia if you have questions. So that way, if you do have any major changes in your situation, like new medications, new doctors, maybe you're moving, we can always try to give you the best advice whatever your situation is at that time. We're going to give you the best advice. Now, oh, shoot, it's already 15 minutes. Can you keep this going, Sylvia? I'm going to get my charger. If you want to add anything else, you want to start talking.
Where are you going? Okay, so I was thinking about something and now I forgot. It's very important. And also remember that the PPOs, you don't need referrals, but I don't want to go way off and confuse people, because sometimes I have a tendency to go out left field. But on some of the PPOs, some of the doctors that will accept your PPO might ask you for a referral. And I've had a handful of people in the last year or so that have called me and said, Sylvia, you sold me a PPO, and this was a while back, and my cardiologist wants a referral. So I always let my PPO clients know that in the event you don't need a referrals, but some specialists might ask for a referral. And so if that happens, you will have to get a referral. Like I said, probably in the last 2-3 years, probably about 5 clients have called me. And so I don't know if that's going to be the trend. I don't know if doctors are going to want PPO doctors want a referral, but in the event they do, then you will have to abide by their rules, Doesn't happen, but if it does.
Now, you brought up something that you just reminded me of. So here's what happens a lot too, and you may have said this, and I may have been a very, very bad listener.
She doesn't listen to me.
I get told that a lot. I really do think I have like some type of focus disorder or something. Anyway,
See, there you go. I can tell because she has this look in her eyes.
I like Google.
Not a killer look, but just kind of
like a staring weirdo kind
insanity
of
look.
Maybe I'm insane. Am I here right now?
Yeah.
Am I really
I've
here?
Always known that.
Okay, this is what I was going to say.
Okay.
So with PPOs, when you have a PPO,
yes,
be careful when you go to the doctor. They'll say, "Oh yeah, we take that," right? But that doesn't mean they're in network with the plan.
Exactly.
So what happens is you're like, great, awesome.
I love this.
They take my plan. And then what happens?
Walking out.
And then they give you that nice little bill. Like that.
You're like, no, I was supposed to pay $30, $40, $50, and you're charging me double the amount.
Exactly.
And a deductible.
Exactly.
And you're like freaking out. So you have to check all your doctors when you meet with an agent, whether it's an HMO and a PPO. You have to get a list and have her or him review and make sure that they're all in the network. Exactly. And if they're not, you need to know that up front to make sure that, okay, I'm not going to see Pretty Boy Doctor down the street. I'm going to have to go see another doctor.
And we say that a lot, but we have a lot of clients that are like, "Oh, Miha, he's so cute. He's so cute." And I'm like, or I hear the ladies talking when we were at the senior centers, they'd say, "Oh yeah, Dr. So-and-so. Oh, really? I want to go to him." Yeah. So yeah, we know you know who you are out there.
You are out there. And the senior center on Thousand Oaks is open.
In San Antonio.
In San Antonio on Thousand Oaks. They're only open for 50 people a day. And they're still giving out the lunch. And so we're still waiting. I used to be there every Thursday. And they haven't let any vendors. So as soon as we find out that they're opening up at 100%, hopefully in the next month.
Yeah.
But they're still giving out their lunches. So if you're in that area and you used to go to the Thousand Oaks Senior Center, call them and see if you can get on the list and go out there. They're not doing any bingo or dining in. It's all, I don't even know if they're doing the computer classes, but you can go work out. Because if you're like me, we've gained a little weight during this time. And so call them, make sure, tell them Sylvia said hi. And hopefully we'll be able to see you soon there.
Yeah. So if you guys are listening and if you're in a different area, I know I have some Corpus, Houston, people all over, not just in Texas, but if you know of any resources that are open, that things are starting to open up, let us know so we could put it on our page and let people know. We want to let the people know what's available, what's open, and we'll try to get more of a sheet going. We have about 10, 15 more minutes on this show, guys. So you still have time to put your name. So far, we only have 4 names to give away for the camping chair, folding chair, and a lunch cooler. So put your name. It doesn't matter who you are. Don't be shy. Don't miss out. You can give it away as a gift. People love to re-gift stuff. Why, and plus summer's coming up. Who can't use extra stuff, right?
Yeah.
So I know the people that are in here is like, no, Victoria, don't put other names in there. Our chances are going to be.
win one of those things.
So if you're listening, doesn't matter if you're family, friends, agents, customers, enemies that like to listen to the show. We don't have any enemies, to be honest. So
who doesn't love us?
Who doesn't love us, right?
I'm adorable.
You are adorable. You are adorable.
So my daughter tells me, but she's my daughter. She has to tell me that.
I'm sure my mom would tell me I'm adorable.
Of course you are.
I'm going to have my little crazy eyes.
We didn't call your mom today.
We didn't call my mom today.
Call her, see. I want to ask her if she thinks you're adorable. Out of all of their daughters, which
if
was
my
the
mom,
most
if
adorable?
my mom is on, hopefully she's not at work, but let's see. I can call her. Let me turn this up a little bit.
I'm going to put her on the spot and ask her which one of her, her
that's
daughters
a good
is
one.
more adorable.
Yeah, let's see. She's going to say me, but
of course she is.
If she doesn't,
you are.
All right. Mom.
Okay. Miss Mom.
Please leave your message.
She's like, I don't want to decide. She's
I'm not.
well,
I'm going to call my sister. I'm going to call to see if my sister thinks I'm adorable.
Okay, let's call the sister.
All right, I'm calling my sister. She's going to kill me, but.
Hello,
Priscilla.
Priscilla.
Yeah.
You're on live with the Medicare Space podcast.
Hi, Priscilla. It's Sylvia.
And we wanted to ask you a very, very serious question.
Because we know how smart you are.
Oh, yeah. I'm told.
And Sylvia's going to ask you.
We want to know, out of all your sisters, which one is the most adorable?
You're trying to get me in trouble here.
No. This is a legitimate question. We called your mother, but she didn't answer. She didn't answer because she didn't want to be asked.
I already know what she's going to say because she knows I don't get butthurt about things. So
yeah, that's true.
So you have 10 seconds.
But I have 2 other sisters that I
gotta do it.
Very close by to.
Okay, we won't put you in the spot.
We all know that you're the most adorable, Priscilla. Yes. There you go. Hey, Julia and Andrea are going to be like, well, I am the most. All right. Thank you for answering. Bye-bye.
Bye.
Okay, bye. Bye. Well,
we know that I'm the coolest of them all, but you know. Anyway, we got off track, guys. We want to get,
we always do.
We always get off track. We always get. So are you listening? Jessica, do not say anything, Priscilla. She already knows.
That's
so
why
again,
your mom didn't answer.
Yeah, my mom's like, I'm not answering.
Wait, am I gonna?
We all know I'm her favorite.
Yes.
We already all know that. All the kids already know that. Okay. So if you're listening right now, you still have time. You got about 3 or 4 minutes to put your name in the comments or just thumbs up or hi or whatever. And we're going to go, not a thumbs up in the like because we can't see you. So you have to put your name in the comments. Otherwise we can't see you. And then, so that way we can go ahead and
put names on the thumbs up.
Well, the system's kind of weird. I can't see everything that's going on, but I can see the comments. So the comments I can see. So when you put a comment, I can see your name, but you have to put your name in. So that way I can see who's posting the comment. So we have 4 right here. So again, guys, you have still time to put your name. Doesn't matter if you're an agent. Doesn't matter if you want again. Doesn't matter if you're a friend, family, customer, client. Doesn't matter. Put your name in. We're going to be giving away. And what are we giving away next week? Next week, we're going to get you guys exercising.
Yes, exercise.
So we're going to get a yoga mat.
Yes.
We're going to be giving away a yoga mat. And we're going to be giving away one of those balls, those big
circles. The network circle we're going to give out.
Get your mind out of the gutter, okay? We're going to be getting those workout balls, those ones that are like.
Or maybe even those for your hand. I use mine, the little balls for my hands because my hands cramp up really
that might
bad.
that might be better.
You know,
we don't want any accidents happening. Maybe we'll do the little squeezy things.
Yeah,
stress
so maybe
balls.
Little weights for your ankles or just something. That's what I need.
Well,
I need to win that.
So let's go ahead and give something away right now.
Okay.
Let's see who won. You still have time. So we're doing it right now because there's only 4 people that wanted to go ahead and put their name in. We're going to change it up here. All right, ready? This is for the camping chair, the folding chair, okay?
Oh my God, could you have made this any tighter?
I didn't want you to see. I know you didn't have your glasses today.
I don't have my glasses.
So I might have to read it anyway. So there's no way we could cheat on these things, okay? Because Sylvia probably might not be able to read my chicken scratch handwriting anyway.
Josie,
she won the folding chair.
Cool,
all right,
Josie.
Cool. Okay.
And then we'll wait. What time is it?
We got about 2 more minutes. So anyway, guys, thank you so much. I mean, today we talked about the differences between HMO and PPO. I hope y'all learned something. That's our goal, is to, not only just chit chat and be funny, but we want to bring information that you actually can take away and have learned something. So if you're not learning anything, we would enjoy your feedback because, we want you to learn something. That's the whole point of the show, right? Aside from me and Sylvia just chit-chatting, we could do that all day.
Yes.
And I don't think y'all want that, right? So
it might be fun.
I mean, it might be fun, but let us know what you want to listen to. Listen to, like we're a radio station. Do you want to hear some rock and roll? What do you want to listen to?
Oldies, some oldies, a little jazz.
Yeah, we got it all.
Did anybody find out if it's going to be open tomorrow? Retama Park?
Oh, no, nobody say anything. Nobody say anything. So we'll have to call them.
We're going to have to call. I've been calling them. Nobody answers.
Well, we'll have to just show up and knock on their door with our horses, ready to race.
Horses, with my hat.
Yeah, with her big hat. She's going to be the only one. But,
next week is Cinco de Mayo?
Well, yeah, kind of.
Right?
So, yeah, next week is Cinco de Mayo. We're probably going to wear some funny sombreros. So like I said, guys, listen in next week, 10 a.m. every Friday. I will say this, though.
Say it.
I have to, unfortunately.
She's going again out of town.
I believe in my self-development. So I have to keep this going in order for me to. Okay.
And so I won't be here in July. We're going to Cancun.
Awesome. So on May 14th, which is not next week, but the next week, we might have to postpone the show until the next weekend. Again, guys, we try to do this every Friday. Unfortunately, sometimes because I'm the only one that knows how to work the systems, Sylvia might post pictures that she's not supposed to if I put her in charge. Okay. So on the 14th, we won't be available. I will be out of town at the 8-figure mastermind in Vegas with.
I want to go.
You want to go?
Perhaps.
All right. So anyway, long story short, we're not going to be here that day. We'll probably just repost an old episode, maybe from the beginning that you guys haven't watched. But we love being here with you live, right?
Yes,
so we're going to try our
And
best.
it's fun. And one day,
and you know what we should do?
People.
We maybe that week we could do it like on a Tuesday, so that way we don't lose out.
Yeah.
So maybe that week we'll do it on a Tuesday or Wednesday, depending on what time I leave to the airport. But it'll be either a Tuesday, because I know you guys love us. I know we have the best
nonsense.
Yeah, our nonsense and everything else. Okay, so let's do. So again, every Friday, 10 a.m. unless otherwise, and we'll always let you know on Facebook, YouTube, and all these other channels. Okay, who's gonna win the lunch cooler?
Lunch cooler.
If you don't want it, you can give it away. Or if you don't want it and you want to gift it to like your mom or your dad or something,
send us the address.
You could just send us their address and we can send it there. Okay.
There you go.
And I promise you, we're not going to call them and mail them and all that craziness.
No.
Okay. All right. Who's the next winner?
Gucci, Gucci.
Ooh.
Okay.
Now I just sound like a broken. You got it? I know. I did it tight this time. I'm sorry.
Super tight.
Super tight.
Okay.
All right. Let's see. Again, you don't have to be present to win.
Claudia Diaz. Claudia
so
Diaz.
There you go. We're going to mail that to you. Claudia will mail it to your office, to your home, whatever you want us to do. So she won the cooler. Okay, guys, cool. If y'all don't have any questions, thank you so much. We really appreciate you guys and your engagement. We really do, because by you engaging with us, it actually, with Facebook's algorithm, I'm going to use a fancy word that I don't even know what it means.
Spell it.
When you post like that and you like, more people get to see it, right? So the more you do this with us, we love having you. We appreciate you sharing the show. We love doing giveaways. Me and Sylvia love doing this. So if you have any questions, things that you want to hear, give us a call. Put it in the comments. We'll try to make it happen. And anytime we're not going to do it that specific Friday, we'll always let you know what day we're going to do it, because we do want to make this a weekly thing where we're here for you every single week. Obviously, we're here for you all the time. If you have questions about Medicare, call Sylvia 210-878-9534.
Yes, finally, after 5 years, she memorizes my number.
All right, guys. Thank you so much for joining in. And we will see you on the next episode next week at 10 a.m. Central on Friday.
See you guys.
Bye-bye.